Good afternoon. I want to thank everybody for being here today. As you know, there's been a lot in the news lately about increasing COVID-19 cases in Missouri. Today, I want to take some time to get a little more background and explain our data here in Missouri. Currently, Missouri's 7-day average for new cases is approximately 1,600 per day. We are seeing an increase in cases right now, but like I said last week, the entire Midwest is seeing an increase. I also want to point out the importance of looking at a 7-day averages rather than 24-hour increases. The day-to-day numbers can shift drastically for a variety of reasons. For example, on some days, DHSS receives a data dump of test records from a lab or provider that has accumulated over a period of time. This can sometimes cause a spike in the positive cases that did not all occur within a 24-hour time frame, but over a period of several days. Likewise, DHS has also consistently seen a decrease in the number of tests reported and therefore cases on weekends versus weekdays. This cycle causes non-representative dips and spikes in the numbers each day on the dashboard as those samples are tested and reported by labs. Similar situations also occur with the reported COVID-19 deaths. There have been many times when additional deaths have been reported and did not reflect what happened in the previous 24 hours. DHSS receives reports from COVID-19 related deaths in a variety of ways, from providers, health departments, long-term care facilities, and more. There have been times when health care departments have reported several COVID-19 deaths at one time. And it appears on the dashboard as a one-day spike in deaths when they actually occurred over a much longer period of time. In addition to the daily reporting, DHSS also analyzes incoming death certificates on a weekly basis, identified any COVID-related deaths that haven't already been reported by other means. This typically causes a sharp increase in deaths added the following day, which is most often on Saturdays. Again, it is these situations. Not all these deaths occur in 24 hours, but over a period of time. It is for all these reasons that we look at the 7-day trends and how they have changed over time, and we encourage all Missourians to do the same. The 7-day trends give a better representation of the true impact of COVID-19 in Missouri, rather than the day-to-day numbers, which can vary greatly. There has also been a lot of focus lately on the positivity rate. This is an important measure used by public health experts to better understand the spread of COVID-19, despite the ups and downs of total testing numbers from week to week. However, multiple methods are used to calculate positive rate, so these rates are often varied depending on the source and how the rate is calculated. Many states calculate the rate differently, which means comparing rates reported out of each individual state is often misleading. Some states do not report positivity rates at all. To date, DHS has used a conservative method to calculate positivity rate. More than 900,000 Missourians have been tested more than once. However, our data, regardless of how many times you've been tested, is only counted once. For example, the CDC uses a different method, so the positivity rate for Missouri is lower than what we report. As of today, the 7-day positivity rate shows 21% for Missouri. But using the CDC method of the same 7-day range, the rate is 10.7%. The CDC simply takes the total number of positive divided by the total number of tests. So no matter how many times a person is tested, each test is counted toward the rate. So, say a person is tested 10 times. The test is negative each time. The CDC would count all 10 of those tests in calculating the positivity rate. At the state level, we count that as one test, which is why our rate is higher than what the CDC and some other sources report. With that said, both methods can help public health officials understand the spread of COVID-19 in their communities. So starting today, both positive rates are reported on the dashboard. I think I want to be clear where I'm going with this. Most people is going to use the CDC, the state dashboard, or Johns Hopkins. And what you'll see a lot of times reported in the media will be the worst case scenario, not using what the true facts are by using from different of these sources. What we are trying to say to the Missouri people out here, you need to look at the data from whatever entity is providing it to get a real idea of what's going on. And I think many times that's used and continues to be used on different levels. So what we want to do is try to clarify as much as we can for Missourians that they know what the real numbers are. And when you do see these spikes, that you know what's behind the spikes in a much more way of reporting it. As far as COVID-19 hospitalization, our current 7-day average is roughly 1,400. Again, while this is higher than previous levels, overall our healthcare system is still stable and meeting the demand. Our fatality rate has decreased from over 7% to 1.6% today. So although we are seeing more positive cases, fewer of these cases are fatality. This is a positive sign, and we are very thankful that the vast majority of Missourians are recovering. Just as we have throughout COVID-19, we continue to monitor the data every day and are constantly working to improve and recover. On the economic front, continue to receive good news. Even in the midst of COVID-19, companies continue to expand and invest in our state. Just yesterday, we attended a ribbon cutting for Optimus Solutions, a global industrial distributor and service provider that is opening a new 30,000 square foot PPE distribution center in St. Louis. On Friday, ETS also announced plans to expand to St. Louis, retain all current jobs, and add additional high-paying jobs. Last week, we announced that Missouri's unemployment rate dropped to 4.9% in September, down from 7% in August. This puts us at number 6 in the nation for the lowest unemployment rate. Missouri has now recovered nearly 218,000, 63% of the jobs lost to COVID-19. Thanks to our Show Me Strong recovery plan and a balanced approach, we are outpacing our economic and budget forecast, which is why a couple of weeks ago we were able to release some of the general revenue funds restricted earlier this year, as well as nearly $95 million in CARES Act funding. In addition to this $95 million, we still have CARES Act money that needs to be distributed to Missourians, which is why today I am calling a special session on a supplemental budget to begin Thursday, November the 5th. The supplemental budget contains funding for several items, including school nutrition service programs, job training grants, emergency solutions grant program for the homeless prevention, domestic violence grant, and child support payments. We look forward to working with the General Assembly to make sure these funds are distributed across Missouri as soon as possible. Tomorrow, we will be traveling to the Kansas City area for 2 more business announcements and a ribbon cutting of AA Farmers Co-op. Like I have said many times, it is a balancing act between COVID-19, the economy, violent crime, and the many other challenges facing our state right now. COVID-19 isn't going to disappear, so we must keep pushing forward on all fronts while we protect ourselves and others. And those three keys are social distancing, staying away from large gatherings, wear a mask, wash your hands. I cannot emphasize enough how important this still is, especially now with the flu season approaching. And if you haven't already, I highly encourage all Missourians to consider getting a flu shot. The First Lady and I received our flu shots every year, and this year is more important than ever. The fight is not over, but we have come a long way in the past 8 months, and we continue to make progress every day. Thank you, and God bless. Are there questions here, or Dr. Williams, Kelly? Dr. Williams?
Thank you. I can't say it any better than the governor. Just incredibly appreciate people getting their flu shots. We've looked at our data through September 25th, which is the 8th week in our flu season, and we're up 19% for flu shots. And the governor and the First Lady have led that campaign. Many of you reported, I've read your articles, I've listened to you, on the tremendous pressure this has put on our healthcare workers. Read an article today about that, so thank you for bringing that to people's attention, having practiced for 30 years. And I would also include dentists in that, and I got a letter from the veterinarians yesterday, and would include veterinarians in that. They're certainly part of taking care of our loved ones. If you knew how much my dog loved his vet, you would understand, and I think many people do, that they're very, very important too. But I think one of the kindest things you can do for those people who are on the front lines is to get a flu shot right now. It is one way to decrease the pressure on our healthcare system, and it also, I can tell you, having practiced for 30 years, it really helps clinicians as you might present with symptoms if you've had your flu shot. So thank you so much for what you've done to help get out that message. I'll add one more thing, then take questions. We're incredibly excited still. Pfizer has announced that we think, and the CDC just announced today, that we should have the vaccine here in Missouri by the end of this calendar year. And our plan that we talked about last Thursday was sent to all 50 states by the White House as a model plan. So just cannot thank our team as a whole government approach for putting that together and kind of being a thought leader on that. So Kelly, glad to answer any questions. Hey, Philip.
In the vaccine distribution plan, about 3.3 million people are in high priority groups.
Yes.
But how many of them is it feasible to actually vaccinate? What's your goal for how many you'd like to have vaccinated? Yeah,
again, it's going to be sequentially rolled out. Obviously, the plan, obviously, first is healthcare workers and those people who are forward facing. And so my sense is we'll probably get to phase 1A pretty quickly in a limited amount, and you saw the numbers for each of those. Philip, after that, once we get into January, February, and March, those numbers get pretty big. You can see them in the plan, just how many people are in those categories, and we will just move through them sequentially. So I can't give you an exact number, but I would tell you our timeline, I think, would be to vaccinate them in January, February, and March.
Clarify?
Sure.
What's the trigger for moving from one phase to the next? You know, is it a percentage of each group?
Yeah, it's the amount of vaccine we get. In the plan, if you'll look, it sequentially starts with our people who are at highest risk, our elderly with comorbid conditions. They start first, and then after that, we're just going to have to reassess. We, at this point, have not ranked those other groups until we see how much vaccine we get.
In the vaccine plan, one of the priorities is people living in congregate facilities.
Yes, Kurt.
Does that include prisons?
Yes, it does. We move through that. So prisons, long-term care facilities, yes.
So a prisoner possibly could be vaccinated well before healthy regular old citizen?
Yeah, back to Philip's question, we have not prioritized that group yet, so that answer, I don't have that answer for you where they would fall in that category, but clearly we know from our data that people in congregate living facilities are at higher risk, but sequentially where they rank in that second phase, we have not yet done that.
Hey, Dr. Williams. So in Boone County, we've seen kind of a decrease in demand for testing that the county health department has observed. It's kind of my understanding that that's been the case also with some of the community testing events y'all have held. Mm-hmm. Have you seen that decrease in demand for testing on a state level, and is that a concern, and how do you address that?
Sebastian, we have seen that, and it is a concern. And I just left a meeting of 1,000 state employees talking about this. You know, the governor has been incredibly purposeful about being able to test 2.2 Missourians. It is literally foundational to what we do. So we recognize that trends. We're looking at the reasons for that. But I'm just here to reiterate, as I just did to 1,000 state employees, it's just really important to get tested, even if you're asymptomatic in a sentinel event. It helps us tremendously. We know from our, I think it's 50,000 or so that we tested, or maybe it's a little less than that it's about 2.7% that'll test positive. But that helps us know. I think it gives people tremendous peace of mind. And so to anyone out there who goes, well, I'm asymptomatic, I'd just rather not know if I have it, I would really try to dissuade you from that, because you might be asymptomatic, but your loved ones, and we know you're infectious if you're asymptomatic. That's one thing we've learned during this disease. Your loved ones may not be. So we just really would say that even if you go, well, gosh, I'm asymptomatic, I don't think I'll get tested, or if I'm a contact, we really hope you'll take advantage of how hard we've worked to make that available to you, and for those you love and those you care around you to get tested.
Hi, Dr. Williams.
Hey, Jackie.
I had a quick question about the vaccination plan. I know throughout the document it said that there was an emphasis to ensure that every Missourian could get a vaccine for free.
Yes.
But as you mentioned last week, that there could be a small administration fee. Also in the document, there is no maximum administration fee. So can you clarify what people may have to pay?
Yeah, the number I've seen was like $20, but if I may be corrected on that. But, you know, providers are allowed to charge an administrative fee, but clearly built into our system is that there will be, you know, you saw that we're talking about doing them in gymnasiums, we're talking about doing them in drive-through, that there'll be both a provider component to this, but there'll also be kind of mass vaccination. So I do not anticipate cost being a barrier to getting vaccinated.
Another question I had in terms of when the vaccine comes to the state, I know that there are several types of vaccines in the final stages,
Yes.
and we're not sure which kind we will get. Will there be a need, or will there be money for those providers who are providing the vaccine in terms of like cold storage or things of that nature?
Well, as you know, that's been very much discussed on the national scene in the last 24 hours. That's been very, very contentious. And so that is to be decided. At this point in time, all the vaccine, the syringes, the PPE, all comes from the federal government. So to your question, will there be additional funds in that? I've spent the last 24 hours of my life dealing with that on a national scene. I'm on the board of directors of ASTO, and we had a 4-hour meeting yesterday about this. Among other things. And so I think that's yet to be determined.
We'll take 2 more questions. Gladys and then Ryan. Ryan's for Governor. Okay, Ryan.
Yeah, Dr. Williams, want to make sure I got the number right. To follow up on Jacqueline's question, Senator Blunt has said that nationwide it would cost $6 billion to actually distribute the vaccine, and it's federally funded. But my question is, as far as bearing the cost, who bears that? Are you waiting for HHS funding? Will the state cover part of that, or will that be part of the special session the governor just referred to?
Well, again, it's a national issue right now in that, again, the vaccine is free, the syringes are free, the PPE is free. You're allowed to charge for it. So the number you've heard from Bob Redfield and Senator Blunt is $6 billion requested for additional funding to possibly cover other expenses. Secretary Azar said that at 2 days ago, I guess it was, that at this point he did not anticipate that type of expenditure. So right now there is a national discussion that we're very much participating in to see just what that number will be for additional federal aid for those other costs.
One more question, Chanley.
Okay.
Hi, Dr. Williams.
Hey.
Governor Parson said the fatality rate has gone down.
It has.
But would you say there's a hospital bed shortage or crisis all over the state?
No, there's absolutely not a crisis. We have a very strict definition for that called crisis care, and that's not an issue here in Missouri, and has not been, thank goodness, during the. Well, at this point, we have an increased number of hospitalizations, but we don't have a shortage yet. The thing that we've learned about this is that the critical component for us is ICU and ventilatory capacity. And one thing we very much learned is we're trying to use ventilation as little as possible, because one thing that's very much changed in my thinking and others' thinkings from March is that you want to do that less rather than more if you can. So I'd say this time, I was on a phone call with the Missouri Hospital Society this morning, that we're stable. We are. We have enough ICU beds. It's interesting, circling back to the very first thing I said, when you talk to the people in St. Louis and you talk to the Missouri Hospital Association, one of the limiting factors is not the number of beds, it's the staff. That we're finding that for a variety of reasons, and we're hearing this. The governor and I were on a call Saturday with all the infectious disease doctors that we talk to every Saturday. And so, to be honest with you, what we're looking more is listening to them is our concern about the staffing as it is the physical bed. And so that's just, again, I'll finish up. One thing that would help greatly with that is, as somebody who practiced for 30 years, if I'd known you got your flu shot, it sure makes me feel more protected, and it also helps me know that I can kind of decrease our bed utilization from that. So thank you for asking. Thank you.
Dr. Williams. Governor Parson?
Let me just add a little bit to what Dr. Williams said there at the last when you're talking about staffing. I've said this before up here, but I think it's very important. These people's been on the front line, these hospitals, these emergency rooms, EMTs. People have been out the street the entire time, have had no break. They've been fighting this day in, day out. One of the things that we did just here in the last 2 weeks, trying to figure out how do we do this long term. We know this virus is going to be here for a while and we're going to have to deal with it. I think that's the exact reasons we helped with the expansion of Missouri Western and their nursing school. To addition to that, why we expanded St. Louis Community College. And at the end of that, that's about 1,000 nurses that will be coming out of those institutions. The sooner the better. But I think it's important. We talk about a lot of things, but a lot of those people and their families, been at this for 8 months. And I just appreciate their dedication or loyalty to a job that most people don't want to do on that.
Good afternoon, Governor. I've got a couple of questions for you. First of all, about the data and the 7-day, looking at it long term. This is something you said on the radio today as well as here. The case average of the last 7 days is actually 1,741 per day, which is the highest daily average, 7-day average that we've seen so far. And taking it out even a little further.
Now, let me ask you, are you using CDC or using our dashboard?
I'm using the data that is reported by the Department of Health and Senior Services.
Yes, but you normally use John Hopkins or the CDC when you write an article.
I always use the data that's coming from the state every morning.
All right, we'll disagree with that. Go ahead with your question.
1741 over the last 7 days. So going out to the going out even further, so far this month, 39 states in the Union and the District of Columbia have a infection rate per capita that is less than Missouri, and 2, Vermont and Maine, 13 or 1/3 of Missouri's rate, and 2, Vermont and Maine have 1/10 of Missouri's rate. Have you looked at what those states are doing and tried to bring any of those efforts to Missouri to reduce the rate?
Well, I think you just seen an article the other day that compared Missouri and Vermont. talking about what we were doing here in these two states that were one of the top two states in the nation, how we was dealing with this. I think when you look at the other states' averages, Missouri's right in the middle of the Midwest, where you know very well that's the hottest part in the nation right now. You know that, what we're doing, and you compare us to those other states. I don't know about Montana. Montana's a little hard to represent a fair representation of Missouri when you got Kansas City and St. Louis. I'm not sure Montana's going to quite compare to Missouri as far as have to do that. So you got to realize where you're at, the diversity of the states and different things. Look at the Midwest. That's a fair comparison. That's where it's at right now. All right.
What do you have to say to people? The holidays are coming up. I've done a lot of interviews where health officials just say, you know, congregating and being together with your family can be very dangerous right now. What would you have to say to Missourians, being that the holiday season is coming up?
Yeah, most certainly. You got to be real cautious about that. I mean, my family, for example, is a pretty large family, and we're not going to be able to be together like we normally are. So I'm going to go back to, I think we all have to take the responsibility to understand what the importance of this is. And I'm going to go back. Again, we talk about the mask a lot, but social distancing, being around somebody for 15 minutes, is just as important as a mask. Keeping your hands clean. It is all three things. So I think when you talk about families getting together, you have to take that all into account and make sure you're taking care of yourself. But care of yourself and other people, but more importantly, other people, your family members, your neighbors. I mean, that's all upon our responsibility. I think sometimes we talk about a mask and we think we're wearing a mask for us. But the reality of it is we should all be doing our part to help one another. And I think that's a message we've tried to say for 8 months up here. And I think for the most part, people are trying to do that. But I think there's also the point out there. The truth is there's a lot of virus fatigue here in this state as you travel around the state. But you just got to keep pushing forward. We've got to keep giving the advice to people and keep moving forward.
Yeah, good afternoon, Governor. Two-part question. You mentioned the special session and the supplemental budget. What's the main aim of the special session, if you'd elaborate on that? And my second question, we reported today another 11 deaths of veterans in veterans' homes, 67 deaths, Governor, since September the 1st at the veterans' homes, all from COVID. Your reaction to that, and do you have any other update on the inquiry?
Let me just say this. I'll be careful kind of how I say this just because of the legality side of it, I guess I want to say. We were doing some of the best in the nation as far as how we was taking care of our veterans in these veterans' homes. There was a spike that occurred that definitely raised red flags. As soon as we were made aware of that, the day of, we started putting our people in place to start reacting to that, to do box-in strategy, to see what caused it, contact tracing, things like that. And as we move forward, we definitely are continuing to put a stop to the spread of that COVID-19 in those veterans' homes, and we're aware of that situation. There was an investigation that was looking into that and is looking into that, and at that point we'll release that information once we get that, but I don't have that right now. But definitely a red flag of what happened. Disappointing.
Hi, Governor. On special session, how long do you expect it to last, and would you be open to including any other topics in it at all?
Yes, I would. If the legislature was willing, I think the legal liability issue should be front and center in this state. If it's not done in special session, it definitely should be a priority in the session. Hopefully that's something that could be done in the first 30 or 60 days. But I definitely would consider that if both bodies come together and say they have a plan in place and that we can work together to get it done. I'm open to that. The special session, mainly the things I read about on the budget, is why I'm calling the special session. Really, we have to just to be able to get money in and be able to get some money out to pay some bills.
Same topic, special session. Have you had any meetings with members of the leaders in the House or the Senate to discuss details?
Yeah, I think there's been going on. Oh, I'm sorry. Details of what I said,
yeah,
or suspect of things to add.
No, yeah, what you want to get done.
Yeah, we have. We've met with both chambers. I think they're fully on board. So the special session, as far as I'll let the House and Senate decide what those days are. but I think it's more of a technical session than it ever will be. It shouldn't extend past the timelines that we're talking about. It should be very short. They should be in and out very quickly.
Our last question, Rudy.
Governor, the CDC has a moratorium on convictions, yet in courts around the state, eviction proceedings are moving forward. As you move into the special session with the CARES Act funds, are you thinking of allocating any of that to representation for people who are facing eviction, or to help them catch up on their rent so that they can remain housed?
We've had no discussion on it.
All right, thank you, Governor.
All right.
Can I ask
Yes.
one quick question about Cori Bush and the tweets this morning and your response, please?
Well, first of all, let me just say it was a total irresponsible thing for any elected official to say that. It is very irresponsible for anybody that supports, any elected official that supports those kind of things. When you talk about defunding the police, as you well know what I've said about that. When you talk about defending the Pentagon, that is not to be taken lightly by anybody in the state of Missouri. And as a veteran, I find it personal when you start talking about trying to do away with our men and women that serve this country, that serve this state. When you take a look at our military in the state of Missouri, when you look at things like Boeing, for example, and the federal contracts that they have every day for the people of this Missouri, the jobs they create. If you take NGA, of all the work that was done to bring NGA into an area that needed support in the worst way, and we send a message to the Pentagon that we don't want that here in Missouri. When you look at Honeywell in Kansas City area, when you look at $30 billion worth of economy that Fort Leonard Wood, Whiteman Air Force Base, all the places around the state, St. Joe, Springfield, what that brings to our state. To send a message like that, it has effects. It has effect on people in our state. It has effect on people in this nation. Not only that, our National Guard, anybody that would consider cutting our National Guard, cutting the expense of it when they've been on the front lines for 8 months, when they delivered the remdesivir to people at 3 or 4 o'clock in the morning to hospitals around this state, when they did mobile testing all over the state of Missouri for months and still continue to do it, many of it in the St. Louis region where we done that, when they fed school kids all over the state of Missouri, when they were helping people with civil unrest, along with the support in other countries around this world, to even suggest that we do away with our military, that we cut the spending of our military when our state depends so much on that. And not only that, take away the money, take away the finances. Missouri is 15th in the United States for people serving our country, which means this is a very patriotic state. And to make those kind of comments are, one, just immature, lack of experience, and irresponsible. Thank you very much.